Hey guys, welcome back to Medical Coding with Blue. It's Friday! So, first I gotta say sorry for not filming yesterday because I totally had a video planned for yesterday. But this is what had happened. So, what had happened was I like to cook once a month for work just to take in something nice for work and just to try to stretch myself, my culinary skills, and this project for this month was to make meatballs. So I found this really good recipe from this guy from New Jersey. He put out his authentic Italian meatball recipe, and it was a huge success. And eventually, one day, I will get more technologically savvy with the camera and set it up so that way you guys can cook with me. I wanted to be sure that I knew what I was doing before I do something like that because this was my first time, making meatballs. I've never made meatballs before. So I didn't want to be like, oh, what do I do? So eventually, yes, that will be an episode where I am going to cook with you guys and you can, watch me cook and we could talk about food. But yes, that will be coming up eventually, like I said, when I get technologically advanced. But I am gonna do a separate video for Quiz Friday, so that way you guys can have the questions for Quiz Friday, because I am not gonna miss out on that again. And but I'm going to do a video right now about a question that I got from one of the viewers. She was asking me, what is the difference between outpatient and inpatient, and why do they use different books, and why does the inpatient have their evaluation and management codes housed in the CPT book? Okay, so we will be getting into that, and let's get started with that. All right, so let's understand the difference between outpatient and inpatient. Let's start out with outpatient. Outpatient is what I primarily code, so that is why I am more confident when I talk about outpatient. I do need to take a course for inpatient because inpatient rules are different. Okay, they use different rules to pick up different diagnoses, and it's not the same as the outpatient setting. And I'm not going to really go into that too much because, like I said, I'm not very familiar with doing inpatient stuff. I just know like the broad strokes. So, outpatient is anything like in the outpatient setting, like your clinic visits, um, things that can be done and the patient leaves, right? They don't stay. And this is outpatient, okay? Inpatient is just like the name sounds. They're inpatient. They stay in the hospital. They're having a procedure that's done in the hospital and they stay overnight. And that's what they mean when they say inpatient. Because either, surgery is a major surgery and there could be, anything that could happen to the patient, or they have to have further monitoring, or they have many other comorbidities that need to be addressed, while they're inpatient. So inpatient patients stay in the hospital, they stay up on the floor, and their coding is a little different from the outpatient side of the house. Because the outpatient side of the house, we pick up things that are definitive, or what is the most what is the thing that they absolutely do have. Okay, this is why I say if a patient comes in and they've been injured, you can't pick up pain because they've clearly been injured. That's why they came in. We would not pick up pain in those instances unless it is a sequela, because we know definitively that the patient was injured. But if we're not sure if it's a sprain or something like that, you can always go injury unspecified of whatever body part. Okay, because sometimes it's not always possible to make a diagnosis for these providers. These providers are not able to make a diagnosis of what I meant to say right away, because like maybe there's swelling, so they can't see everything, so they have to wait. And so our job as coders is to make sure we look at the documentation and pick up what is absolutely there, as far as what's going on with this patient. For the outpatient side of the house, and this goes for inpatient as well, inpatient and outpatient both get their diagnosis codes from the ICD-10 CM book. Okay, Hands down, that is both of them, okay? Both sides of the house, both outpatient and inpatient. The CPT book, or current procedural terminology book, is, and there's two different versions. There's a professional edition and there's the expert edition. Each one of these is different in its own way. Expert tells you a little bit more about the code itself. So this is why, and it'll tell you like the global days and things like that. The professional edition, it has different information, okay? So if you can get your hands on both of them, then you can see what the difference is, okay? So just keep that in mind. But the outpatient side of the house uses the CPT book, or current procedural terminology. And the evaluation and management codes are housed in the CPT book, okay? When the patient is inpatient, right, and they are having, the provider goes up and does a round and sees the patient and things like that, that provider is getting paid for their cognitive work, which is why they have that evaluation and management code for the inpatient side of the house, okay? That's at 99221 and 222 and things like that. So if you look in that section, it'll tell you what the setting is. And of course, in that case, it's the inpatient side of the house. Those evaluation and management codes are for providers so that they can get paid for their cognitive work, just like on the outpatient side of the house. Where you have outpatient is their evaluation management, like on a regular clinic visit, 99201 to 205, and then 99211 to 99215 for the established patient. So you have new patient codes, and you have established patient codes. Same thing with the inpatient side of the house for the evaluation and management side. You have your initial, right? And then you have your subsequent day visits, okay? And it'll tell you in the book too. So just be sure to review those if it gets a little confusing. Now, the inpatient side of the house, when they have a procedure done, inpatient, right? This is not a same day surgery. This is something that is done while they are inpatient, okay? That is when you have to use your PCS book, okay? So that is a completely separate book. It has nothing to do with the CPT book. So anything that is inpatient, you're going to use your PCS book, okay? The only time that both sides get married in any book is in the CPT book under the evaluation and management codes. That's where you have your outpatient codes and your inpatient codes. And the diagnosis, obviously, is always going to be in the ICD-10 book, okay? So I hope I didn't make this too confusing. But that is the nuts and bolts of what goes on with both sides. And I know it gets confusing because you're like, oh my gosh, all of these books. If you are wanting to code for inpatient, side of the house, then, that's when you're going to have to learn how to use the PCS book. And the PCS book is different because each code is broken down differently. It's not like the CPT book where you can just go and look up a procedure and then boom, you're done. With PCS, it's broken down into different sections, like what is the approach and what is the, why are they doing it, that kind of thing. And which route did they take, whether they did an excision or, that kind of thing. So that PCS book gets a lot more involved. And I did take a course for the PCS when we first transitioned over to ICD-10. But I never stayed with it. I never, I never kept on with it. And I did take another, I went to Vegas with AHIMA. They had a boot camp there. And it was for 2 days. It was 2-day boot camp. They did advanced inpatient procedures. And I went because, I really want to try to stretch myself and learn more. So it was a very good experience. I didn't do very well on the inpatient side because, it was in the very beginning and trying to learn it too. And so I I haven't stayed with it as much as I should have. But I really do like enjoy doing the outpatient side of the house. And I mean, I talk to some of the inpatient coders all the time where I work, and they say, I don't know how you deal with that CPT book. And I'm like, really? Because PCS would seem like it's a lot more harder, you know, because there's a lot more chances to mess that up. You know, there's like, you know, there's all these different, you know, characters that can go in, and it's just like, oh, you know. And they go, yeah, but you guys use modifiers and you use all these things. And I'm like, well, that's true too, you know. But anyway, I just really do need to buckle down and start studying on the inpatient side because, you know, if you want to be well-rounded and you want to be very marketable, having a lot of knowledge does help you, but also having that stretch of being able to code both inpatient and outpatient would be awesome, you know. But it also depends on where you're working. So if you are working in an outpatient, you know, facility, obviously you're you know, not going to need inpatient stuff, but it never hurts to educate yourself and make sure that you're aware, you know, of what is going on. So, but yes, it's very important to understand the function of the different books. And I've done a few videos before about the books. I can do another one again. I do have an old PCS book I can show you guys, but I'll have to do that on another video, so that way, you know, we can do like, this is the books and this is what they look like. But yes, anything that's inpatient is going to be that the patient is staying in the hospital, and the rules for coding the diagnosis are different from the rules that are set for the outpatient side of the house. So that's something to keep in mind, you know. Always remember that there's going to be different things for those two settings, you know. Best bit of advice that I could give you guys is just review those books. And I hope that my explanation has been, you know, okay, as far as like, what is the PCS book for? The PCS book is for procedures that are done inpatient. The CPT book is procedures that are done same-day surgery or outpatient, you know, outpatient procedures that are done in the clinic, like injections, or maybe Botox, you know, chemodenervation, you know, those kinds of things, you know, they're all housed in the CPT book. So, yeah, that's my video for this part of filming today. But if you guys have any more questions, let me know. There is no question that is too small or too like trivial. Questions are best served when they are asked, right? But also be sure to make sure that you're doing a lot of research too. And if something doesn't make sense to you, then ask even more questions if it's not making sense, you know, because guarantee you somebody else probably had that same question too and just didn't want to ask, you know. So, but it is always a good idea to be as communicative as you can. Word of the day, communicative. I know, whatever. But just communicate your thoughts, and you know, if you, like I said, if it's overwhelming and confusing, just stop. Okay, just stop and just take a breath, and it will eventually get better after a while. Because even in the beginning when I first started, I was like, oh my gosh, how am I ever gonna figure this stuff out, you know? And I don't think when ICD-9 was around that the inpatient procedures was as confusing. But I mean, it is a lot more intensive now, I think. It's a lot more detailed, so yeah, that's just my thought on that one. So anyway, I will go ahead and close this video out so I don't get too long-winded. And I will go ahead and start my video for Quiz Friday, okay? So I will see y'all in a few minutes. So if you are a medical coder, a medical coding student, somebody curious about the fascinating world of medical coding, a provider or a nurse, I invite you to like and subscribe and follow me on my journey in medical coding. All right, well, I will see y'all in a little bit. Bye.